There is a healthcare crisis in Pennsylvania. Not enough doctors, long hours spent in waiting rooms, shorter visits.
Not to mention the cost of going to a doctor, even if you have insurance. But for some mobility health problems, a solution that already exists, but few people know about. Channel 4 Action News anchor Sally Wiggins here with a story about direct access.
It's amazing how many people don't know about this, you guys. So listen up. We're talking about something called direct access to physical therapy, an option that has existed for consumers since 2004. What it means is that you can go directly to a physical therapist without a doctor's referral, and in most cases, your insurance will pay for it. Shoulders, ankles, backs, necks, and knees. We need them to move, but sometimes that movement is impaired.
She's too young to have a total knee replacement, so basically we're trying to keep her going as long as we can in keeping her active and fit.
Mary Lee Beach is a doctor of physical therapy and a partner in a practice in Oakmont. Her patient, Cindy Feldman, had knee surgery a year ago, but tennis caused a flare-up recently. So she's taking advantage of direct access.
It was frustrating to wait for an appointment for a physician, wait to see a physician, pay that money, right? Pay that copay, knowing you were going to end up here anyway.
Now, when someone in her family has a sports-related injury, the physical therapist is the first call. Recently, her son was hit by a puck while playing hockey.
And Mary Lee looked at his foot and said, you know what, you need to go for an x-ray. And sure enough, it was broke. So we did end up at the physician. He ended up in a boot.
UPMC and Penguins orthopedic surgeon Chip Burt says it's a bit of a reverse of the system in which the patients were channeled through the doctor first.
It's allowed some of the patients with just overuse injuries to go and be seen and get started on their treatment, and our therapists are very qualified, and if they suspect that there's anything that they cannot treat, then they work to send the patients to us.
Pennsylvania took a long time to get to this place. In 2002, it was the 44th state to legalize direct access to physical therapy. And it took 2 more years for the state board to come up with regulations to govern it. The physical therapist must have 2 years' experience, a direct access certificate, adequate liability coverage, continuing education, and a 30-day treatment limit for one condition before a physician is consulted. Some physicians, podiatrists, and chiropractors oppose direct access, saying physical therapists didn't have sufficient training to diagnose and that malpractice cases would increase. Michael Schneider says opposition was more about turf wars than public health issues.
If physical therapists can show they're competent in seeing people off the street, why do we need this middleman of the medical doctor to tell them to go see a physical therapist? How are we going to increase access to affordable health care if you always have to see a medical doctor for every little condition?
But physical therapist Paul Rocker stresses the team concept.
I can't emphasize enough that it's important for every physical therapist and the consumer to realize we're still a part of the team, and the physician is there for us to consult and send them on.
One Johns Hopkins study with Maryland Blue Cross Blue Shield showed it saved 60 to 75% of healthcare costs. Unfortunately, Medicare B does not pay for physical therapy without a referral, but they are moving in that direction.
How are they doing that?
Well, here's how it goes. So the Medicare patient goes to the physical therapist. The physical therapist does an examination, comes up with a plan of treatment, then sends that to the physician. If the physician okays the plan, then they can go ahead and treat the Medicare patient without that patient having to actually go to a doctor.
So you're not going to have it on the spot. You're not going to have the treatment on the spot.
Because it's a federal program, and that may change that with healthcare reform. Who knows? It's always changing.
All right.
Neat, though.
It is.
Didn't know about that.
Thank you.
You're welcome.